Morning and welcome to these Business Day Dialogues, live in association with the Konrad Adenauer Foundation and the Ecumenical Foundation of Southern Africa. I'm Joanne Joseph, great to be with you today. The topic we're covering is a rather disturbing one, involving one of the most vulnerable sectors of our population, children. Despite South Africa producing enough food to feed its population, we're facing a food crisis that sees many children either go hungry every day or access insufficiently healthy food, resulting in malnutrition or obesity. The National Income Dynamics Study, combined with the coronavirus rapid mobile survey carried out in April and May last year, showed that 27% of households are home to children who've experienced hunger almost every day or every weekday. Now, you may think COVID's largely responsible, but not so. That has been the appalling trend in our country for the last 20 years. The individuals and organizations you'll hear from today are determined to place this issue on the national agenda because they rightfully believe that it's simply not getting the attention or the commitment that solving it requires. Let's kick off then with Dr. Reneberg, Executive Director of the Ecumenical Foundation of Southern Africa Institute. He is going to set the scene for us. Dr. Kuchlenberg?
Yes, good morning, Joanne. It's wonderful to be back again. We started this series last year in partnership between the Ecumenical Foundation of Southern Africa under the leadership at the moment of Bishop Sepuka, who's the president of the Southern African Catholic Bishops' Conference, and our previous chair was Archbishop Mahoba. We work in partnership with the Konrad Adenauer Foundation, political foundation closely associated with the Christian Democratic Union in Germany. Both of us as institutions have a passion for strengthening democracy, having dialogues between sectors so that we are forced to talk to one another, not only in the silos that we know well, but across the sectors. Last year, we started the series on ethical leadership because we know in every sector we are challenged in a different way. But we have to talk to one another to learn from one another. The three seminars for this year are in a sense linked. The first one focused on the conflict in Ukraine, this one on child hunger, and the next one on just energy transition. In a sense, these issues are interrelated. When we started this, we didn't know that. But the war in Ukraine created an energy crisis that spilled over to many other things. We had, of course, last year already a focus on hunger in September, where we especially listened to some of the voices of church leaders and also large NGOs like Food Forward that work with retailers. But we wanted to focus this year much more in terms of what are we doing wrong or what are we not doing to end this crisis, which for us is a moral crisis. So we have invited specialists from different fields to learn from you, to see how we can improve collaboration, but finally also how can we improve coordination. Without better coordination, we can't access national resources or even international resources, unless we work much more closer together. So on behalf of the Konrad Adenauer Foundation and our Ecumenical Foundation, thank you for this opportunity and partnering with Business Day again in this way. I wish you all well for today. Thank you.
Thank you very much for that, Dr. Kuchlenberg. I want to meet the rest of our panel now. Professor Andrew Bahraine is CEO of the Western Cape Economic Development Partnership. He's an international expert on economic and urban development and partnering for systems change, and he's worked in the development sector in South Africa for more than 41 years. Professor Bahraine founded the South African Cities Network and helped to establish the Cape Town Partnership. He's currently CEO of the Western Cape Economic Development Partnership. Joining us very shortly, the gentleman to whom Dr. Kucklenberg referred just a moment ago, Archbishop Dr. Tavo Mahoba. He is, of course, the Anglican Archbishop, and he needs little introduction. He is about to come to the end of celebrating a Mass right now, all in a day's work for an Anglican Archbishop, and he's about to join us shortly for this discussion. But just so you know, he has a doctorate in business administration from the University of Cape Town, a higher diploma in education science, an M.Ed in educational psychology, and a BSc degree from Wits University. His role as Anglican Archbishop encompasses 28 dioceses across Southern Africa. He's also chair of the Anglican Communion Environmental Network and chancellor of the University of the Western Cape. Professor Julian May is a member of the National Planning Commission. He's also the director of the DSAI NRF Center of Excellence in Food Security, director of the Institute for Social Development at UWC, and he holds the UNESCO Chair in African Food Systems. His current research focuses on food security, childhood deprivation, and malnutrition. Dr. Chantal Witten is also a researcher based at the DSI NRF Center of Excellence in Food Security at UWC. Dr. Witten has more than 20 years' experience in public health nutrition within academia, the United Nations, and the broader NGO sector. Dr. Witten currently leads the Infant and Young Child Feeding Advocacy Project for the DSI NRF Center. She's passionate, as you'll see, about child rights, particularly children's right to food and nutrition. Mr. Omri van Zyl is CEO of Agri-SA Enterprises. He's qualified as an attorney. He holds a BA Law, an LLB, an MBA, and qualifications in project management, crime intelligence, and business development. He represents 28,000 commercial farmers in 9 provinces, commodity organizations in various fora, and corporate members. And Omri manages a team that has a strong strategic focus on policy and agricultural economic development, covering, among others, natural resources, rural safety, commercial and labor, and socio-development initiatives. So I'd like to welcome you all and thank you for making the time to be with us today. And I want to say to you, our viewers, from wherever you're watching today, please stay engaged. Make use of the chat function, ask the questions you want, address them to whomever you want on the panel. We'll take as many questions of yours as we can by the end of the session. Dr. Witten, I want to kick off with you because we talk about the triple burden of malnutrition. We don't often enough talk about it, of course, but that phrase is somewhat familiar to us in the public domain. What does that term mean, the triple burden of malnutrition?
Thank you, Joanne, and good morning to the listeners. So when we talk about malnutrition, we're talking about 3 aspects. The first one that most people are very familiar with, pictures of very malnourished children, underweight children. It's the kind of pictures that you usually see when we're doing fundraising for nutrition in Africa. So that is when children are too thin or too small for their age. Then we have children who are overweight, and that's a problem that's happening in South Africa more. We've increased our rates of obesity amongst children. These are children that are too heavy for their age. And then the long-standing problem that South Africa has is what we call stunting. And that indicator is about children who are too short for their age. It's not only about children's weight and height, but it's also about brain development. So we know that there's a direct link between children who are stunted and children's cognitive development, which is actually brain development. And across all of these indicators for malnutrition is what we call hidden hunger, when you do not have enough micronutrients. Those are the vitamins and the minerals. So when we have a very poor diet, not only you're not getting enough energy in your diet, but you're also not getting enough quality of the vitamins and the minerals. And these have an impact on your immune system. So that's the triple burden that we're talking about.
Dr. May, Professor May, rather, we should be speaking more about the issue of stunting because that's a very serious one. What does that term refer to, and what are the possible consequences for children who suffer from stunting?
Thank you. Stunting is indeed a very serious issue. It refers, as already mentioned by Chantal, when a child is too short for its age. But this ultimately reflects an acute malnutrition shock that's taken place at some point, usually in the first 1,000 days following conception. So This can be a shock that happened to the mother while she was pregnant, that she didn't have enough to eat, or that she fell ill, and that then affects the health of the fetus. It reflects, and the measure we use is to take the height of the child and compare it to a normal growth of that child, and we use standards which have been adapted for Southern Africa, so they're appropriate to the kinds of people, the kinds of foods that we eat in this region. But it's more than that. It affects the cognitive ability, it affects motor ability, and critically, increasingly, evidence has shown that if a child has been stunted, it affects the immune system of that child. And that obviously was a huge consequence during a pandemic such as we've just had with COVID. Shockingly, in South Africa, you mentioned the persistence of hunger. Stunting has actually persisted even longer. For the 40 years that we have data, we have more or less a quarter of South African children that have been stunted. It hasn't changed. And it's surprising because South Africa has adopted the same policies as countries such as Brazil or Peru, who started with similar levels of stunting, and yet now have managed to reduce the prevalence of stunting in their countries by more than half. So it's odd. We have the same policies, but we've not succeeded in the same way as other countries have.
Thank you for that, Prof. May. And I think we're going to get into the details of why that is in the second part of our discussion. But Dr. Witten, if I may bring you back in here for a moment, because I think understanding the extent of these obesity rates, child hunger, malnutrition is quite important. Please just give me a sense in terms of the facts and statistics around this, how serious the situation is in our country right now.
So yes, and in terms of stunting, we at a national level, about 27%, which is about, if you round it off up to 30%, that means 1 in 3 children. So 1 in 3 children is too short for their age, which, as Julian has said, affects brain development and health. And that is not only now as in their childhood, but also into their adulthood. So children who are stunted have a higher risk of becoming our future non-communicable disease patients, higher levels of obesity, higher levels of diabetes, higher levels of cardiovascular disease. So we call this the long shadow of malnutrition. So it's not only playing now in childhood, but also in the future. And what that means is that your children will not develop to their full potential. They will not be able to learn well, get them their education, get the jobs that they need to get, and get the earnings. So we call that the poverty trap. So malnutrition underpins poverty, and poverty exacerbates malnutrition. In our obesity, we are 3 times higher what the global acceptable level is. It's 5% in a population. South Africa is at 13% and probably increasing because of the kind of foods children are exposed to. And with obesity, as you know, children, again, are paying because they are not able to be active. They're not able to be healthy. They are carrying a burden of disease that carries them into the future. Again, diabetes, hypertension. This is the next epidemic that it is an epidemic at the moment, but it's an epidemic that's going to explode because of our child malnutrition. And then when it comes to the micronutrients, these are the underlying conditions that predispose you to ill health. So when you don't have enough iron, you're lethargic, you can't learn, your body is not well developed to fight diseases, and so therefore you have more susceptibility to diseases. And the problem is that in South Africa, our children are unhealthy. So when you look at the number of children that are dying in South Africa every year, again, 1/3 of those children under 5 have an underlying cause of malnutrition, either too thin, too fat, or stunted. And so we are paying with child lives.
Thank you for that, Dr. Witten. Archbishop Tavo Mahoba, thank you very much for joining us at this point. We're already steeping ourselves in this discussion as to what the picture looks like in South Africa in regard to this triple epidemic, really, of hunger, malnutrition, and obesity. And Archbishop, I know that you are at the coalface of this, the church interacting on a daily basis on the ground with children who are suffering from any of those three. Would you give us a picture of what you are experiencing as members of the Anglican Church dealing with children in this situation?
Thank you so much. The picture that I will try to draw is from the Anglican perspective, but also from the what I call the interfaith and ecumenical colleagues that I really deal with. I mean, I'm not sure. I'm sorry. I mean, I joined in late. I had just finished Mass now, but. Our child support grant, which helps more than 12 million children, as well as school feeding schemes and social relief distress grants, are admirable. But by 2020, we found that nearly 1 in 5 households experience moderate to severe hunger. And that during COVID, about 10 million adults and 3 million children experience hunger. And 2.5 million adults and more than 500,000 children experience perpetual hunger almost every day, and stunning in certain provinces. And that may sound like statistics. I mean, I was working in Makanda yesterday, which is Grahamstown. You know, I always say when you're in Grahamstown or Makanda, there are 3 important rules. The first one is you have to learn not to cry. And the second rule is you have to refer to the first rule, not to cry. And the third rule is you have to refer to the second and the first rule, not to cry, because you can touch, you can smell, you can see poverty. And during the day, you see children having children because maybe some hope to get a bigger income grant. There are no jobs. And they talk about 60% unemployed youth, but there I think I'm not exaggerating, it's more than 60 or 70%. And with that goes the impact of those triple burden of malnutrition, undernutrition, and micronutrition deficiency, and overweight and obesity that we're talking about.
Thank you, Archbishop. And it brings a tear to the eye, listening not just to those statistics, but to what you're experiencing on the ground, one human being to another. Mr. Pansel, how centrally do children feature in conversations around hunger and malnutrition in the agricultural sector?
Look, I mean, a lot of the agricultural sector is in the rural areas in South Africa. So it's extremely important for, farmers, farmer unions, and participants in the agriculture value chain to take note of, and do something about child hunger. I mean, in agriculture, we employ more than 1.5 million people across the country. That's just in primary agriculture. If you add secondary agriculture to that, agro-processing, etc., probably look at about between 2.5 and 3 million people. So, and many of these families are in the rural areas. Just to put this in context, if you look at food security in Africa, South Africa is the #1 best performer in terms of food security in sub-Saharan Africa by a wide margin. We have industrialized agriculture systems. We export 40% of the food that we produce from here into Africa. And if you look at that, it's a kind of a dilemma that we need to figure out, because food security is premised on 3 things. It's the availability of food, it's the quality of food, and it's the affordability of food. So in South Africa, we are the #1 food secure country in Africa, and we have affordable food available everywhere in the country. The issue is that when it comes to actually buying food, poor people spend between 60 and 70% of their household income on food. And when things happen like the war in Ukraine, fertilizer prices shooting through the roof, input supplies shooting through the roof, I mean, it's literally gone up with 200%. That has a big impact on food price inflation, which in turn has a big impact on household food security. so it is an integrated problem that we need to tackle. And I just wanted to kind of, share that with you so that we understand how the agriculture sector plays into this space.
Thank you, Mr. van Zyl. Am I correct in saying that the bottom line is, despite the pressures that we're experiencing from countries, from instances of what is happening in countries like Ukraine, that when we look at our isolated situation in South Africa, there should be no excuse for child hunger?
Yes, that's exactly what I'm saying.
Okay, so that's an important metric to work with. Thank you for that. I want to look next at this, just get a sense of what is being done to alleviate these sorts of problems that we're seeing in the country. And I'm going to ask each of you to briefly comment on feeding schemes or other such projects that you know of or have been involved in that are being successfully run, and that might even be replicated on a wider scale, perhaps a national scale at some stage. Archbishop, may I start with you, please?
Yes, thank you. I'm just following on Mr. van Zyl. We have a moral issue that we are a food secure country, but the food doesn't reach, and it is not affordable to the poorest of the poor. And in certain instances, because food can never be divorced from health and well-being, we need a lot of social workers and nurses to help people know their rights and to connect with relevant places. And some churches have provided medical people, they've provided some para-social workers, but the extent of the gap is too much in terms of the current trained social workers and nurses and doctors that are there to help our children. We've got for example, the Catholic, Methodist, and Anglican and Reformed churches working together on the health related things that comes from malnutrition and the TB and HIV, where people have to have some of this medication, but they don't have food to take their ARVs. So there are something like 6,000 congregations in every corner of the country that are saying, hey, this does not only need the churches, but business, agriculture, academics, researchers, and government needs to work with us as we try to make a difference. So I've given it in broad stroke, but the church is a trusted partner, and we are there everywhere. We give even that which we do not have to try and make a difference and to make the crumbs arrive at those that need more than crumbs in the corners of our country.
Thank you for that, Archbishop. Dr. Bahraine, I mean, we clearly, Mr. van Zyl has given us a picture, a very basic picture of what the situation should look like. But we know what it actually does look like. And what would you say are the barriers to changing the food system in South Africa so children don't have to go hungry?
Morning, Joanne, thank you. Firstly, there's a lot happening in the short term from government, from faith-based organizations, from communities, from food NGOs, and from business. There's short-term food relief coming in to poor and vulnerable communities. And that's good, but it's not enough. In itself, it's not going to change the food system and the long-term outcomes of the food system. On its own, it's not sustainable. It will not address the deeper underlying causes of food insecurity. So one of the problems is, in a sense, if I asked who owns the problem of food insecurity in this country, we'd be hard pushed to answer. There's no minister of food. I mean, we have a minister of water who looks after water, and it comes down to provincial and local government. We have a minister of energy. We have a minister of health. And these functions are well known in government. There's no minister of food. And many government agencies and departments and provincial governments and municipalities struggle to understand their role in dealing with the complex issue of food insecurity. And in fact, often the response is, it's not my mandate. It's not in the constitution. It's not in law. If I work on food insecurity, beyond some short-term food relief, it will be an unfunded mandate, and I'll get into trouble with the Auditor General. So the whole structure of governance in a state undermines a coherent response to dealing with a complex issue such as food insecurity and poor nutrition results, because it's not an easy issue. There are many factors that have got to be worked on. The other challenge related to the first is that there are different lenses or framing of the problem. Some see it as a productionist challenge. And, as long as we produce enough food through agriculture, which we are doing, as Omri has said, then that's it. Others see it through an economic lens. We must just produce food as commodities because that's where some of the jobs are. But whether or not they're actually getting to poor and vulnerable communities is not the problem. Then there's the social lens. We need a safety net. We need more grants. We need more food parcels. We need more food vouchers. And then there's a health lens, looking at nutrition through, let's say, municipal and provincial clinics. And then there's a rural lens, saying we need more small-scale black farmers. And each one of these lenses holds a grain of truth, but on their own is insufficient to change the food system. And that is why collaboration is an important antidote to the fragmented governance of the food system in our country. And what we need to urgently move towards is not just what needs to be done, because I think that's quite clear, but who needs to work together to make it happen, and how they're going to work together in practice, because we do not have sufficient collaborative muscle in our country, unfortunately, to know how to work together across the sectors, across the silos, across the spheres of government, between government and civil society, government and business. And that is the starting point for addressing this problem.
Thanks, Dr. Bahraine. Dr. Kochlenberg, I know you're not part of this panel, but I just want to bring you in here because the Archbishop was able to give us some idea of what is being seen on the ground. And you too are very steeped in the community. Do you know of child assistance programs that are working successfully?
Yes, there are many. And I can say across all faith communities, of course, I have more experience of working with the churches that partner with us, and even with business sector, even with mines. I think the strong point of faith communities is that they're trusted and are present at local level. And sometimes the advantage they have is they know the families. With the shortage of social workers in South Africa, it's almost impossible to get into every family where there's a crisis. We've seen that on the ground. And there's a whole range of interventions, starting, like Andrew said, from emergency food parcels that was highly politicized. But programs that work through churches was mostly identified through their community networks. Where are the families that are most in need? We know it's more than just about food. It's a whole care package, because food is, of course, the main thing. But if you don't have a framework of support, it's very difficult to make it last. And I say again, from emergency food parcels till community gardens to make a healthy food affordable, there's a whole range of it. And many of them are at local level, in a single town, at a local congregation. So we've done one into partnership with Kuma Mines that worked wonderful, where you integrate food programs and health programs into one program. I think that's a problem of all faith communities, by government and even by other sectors, is they want to work in a way that integrate everything, not standalone solutions. That is a line function. The jargon of agencies and government is focus, which is good. But from a faith perspective, we know these things are integrated. If it's not only the physical food, it's the care and support for the family that counts with it. And I think that's a strong point of the faith communities. Thank you.
Prof. May, how well do you think short-term food relief projects work in our country?
Like Andrew, I think there are examples that work really well, and you were asking for some success stories. So I'm going to reflect on two things that have influenced me a lot in the last week. The first is a stakeholder engagement with early childhood development practitioners that the National Planning Commission organized a week ago. It was a stakeholder engagement. The Commission has a task team specifically focusing on children and early childhood development. And that's under the leadership of Professor Pakana Nchongwani at the Nelson Mandela University. We invited 3 practitioner groups to present what they've been doing in early childhood development, and they amazed me. The work that they're doing, the energy, the way in which they're able to reach out. I will name them if that's okay with you. It's the Early Learning Research Unit, Falani and Smart Start. 3 fabulous NGOs that are doing this work. They receive some support from government, from different spheres of government, and they not only focus on early childhood development, the centers themselves, but also off-center work, how you reach out into the homes of people with children and assist them to learn about exclusive breastfeeding, to learn about the preparation of food that is nourishing and safe. All 3 came back to the same thing. Compared to the investments that we make elsewhere in South Africa, the investment that we're putting into early childhood development is meager. There simply is not enough of the budgets of the different levels of government are being committed to support this kind of work. And again, I think there was mention of the paucity of social workers that we have in South Africa as that front line. So that's the one thing that influenced me. And then, like the Archbishop yesterday, I also was in the field. That's why I forgot to take a hat, which is why I'm so sunburnt today. And like the Archbishop, I had to apply rule number 1 from time to time. What was striking about this visit to Zwelitembe Township, which is near in Worcester, we visited on Saturday, the day in which the pensions and the grants are paid. And the vibrancy of the township on that day was quite striking. The amount of energy, the selling of food, the interaction of people was really quite something to see. And what was gratifying, going into spaza shops, talking to street traders and going into the local supermarket chain, is that healthy, cheap food was available. And that was really striking. It made me think if every day could be Saturday, actually we would have many of our problems solved. We would have problems of unemployment solved. We would have problems of healthy diet solved. It showed that when we have something that works well, and the payment of our grants does work well, we actually are able to have a society that, as I looked at it and I said in the reflection afterwards, I felt that I wasn't in South Africa for a moment, that I was in a place where things were working well and things were going well, and it left me with a lot of hope that day. Thank you.
Yeah. Mr. Van Zyl, I imagine you will have seen some really interesting projects of this nature coming from the point of view of the agricultural sector. Are there many projects in that sector that are working well towards eradicating hunger and malnutrition among children in particular?
Yes, there are. Just going to give you 2 examples of projects that we are working on at the moment. So you must remember what we have in South Africa is we've got a formal value chain. In other words, there's a producer, there's a processor or an off-taker, there's a market. So that's in essence how it works. And one of the projects that we're doing with the Motsepe Foundation is we're matching rural communities with commercial agriculture and funding those. And in that process, it creates an immediate market for the rural communities. There's a skills transfer between the two that is extremely useful. And it opens up a new host of opportunities for communities with regards to, producing food, getting those food processed, packaging, storage, handling, all those type of things. So there were 2 projects that we've recently funded with the Motsepe Foundation, and I think that was one of the big transformational efforts that we've done with the Motsepe Foundation. The second was we actually had a press conference on Monday. After 2 years, we finished training 872 emerging farmers in the livestock space. So that's wool production, goat production, and beef production. So just to give you an idea, we've obviously done all the research and all the surveys, and we looked at the household poverty, of those small or micro farmers, which is about 3,000 rands a month. By doing basic things, by linking them up with formal markets, with genetic improvement on the wool side, for example, with herd and predation management, half the animals in South Africa is owned by rural communities, by rural farmers. And by doing simple things right, you can actually increase their income, and that helps them with increasing, their food security access. Another project that we also focus on is vegetable production and how we can actually empower rural people, because a lot of these people, their literacy and numeracy rates are extremely low. So we go in, we do psychometric assessments of all the participants, because not everybody wants to farm. Some guys want to do other things. We get the willing participants, and we literally build them from the ground up in terms of what is the basic numeracy and literacy. This is what you get for a cabbage, and this is what it costs you, that kind of thing. And we're developing those rural entrepreneurs in that way. And that, in any country in the world, it creates 4 times more jobs than anything else is in primary agriculture. So those are some of the successes that we've been working on. And I honestly think with some capital input, and we've been working with some CSI funding as well, but with some capital input, you can make a massive difference in the rural areas. And we've been working in the Eastern Cape, in the most impoverished areas in the country.
Thank you for that, Mr. Van Zyl. I just want to remind our viewers right now that you can participate by sending your questions in on the live chat. Please make use of us. Tell us who exactly you'd like to address your question to, and I'll do my best to make sure that those questions are asked before our session ends this morning. Dr. Whitten, I was going to ask you to add your 2 cents on short-term food relief projects and which of those work, but I have a feeling that you're going to problematize that and say that it isn't that simple. It cannot necessarily be replicated nationally, and there are all sorts of issues with that. So take us into the next session where we look at the difficulties with replicating this on a national scale and by extension, eradicating hunger and malnutrition for children.
Thank you, Joanne. I want to pick up what the Arch said, and I think this is how I would like to frame my conversation on this platform. The Arch talked about a model crisis of food injustice. I think the minute we go to small-scale activities, 800 trained people in a village makes a huge difference to the village. But does it make a difference to the country? Does it make a difference to children? And unfortunately, it doesn't. And I'm coming from a human rights perspective and a food justice perspective for children. So let's frame it in the model justice space. If companies are still making money and profits while children are dying, it's a moral injustice, and we need to address that. And I think for me, that's the elephant in the room, is that all the projects, and not projects, let's call them the programs that are making a huge difference, child support grant, school feeding program, the old age pension that supports many, many children, these are government-led. We need government leadership. Andrew talked about coordination. We have a national policy called the National Food and Nutrition Policy, which is in place since 2014. It calls on a council that needs to be activated. The council has not been activated. It falls under the deputy president's mandate. And at a household level, households don't engage by sector. Households engage as a unit. And those units need to be able to work to make sure that every child gets access to food every day, not just sporadically, not just as startups that fall down after a few months. So what I'm calling again for, especially because this is led by the religious sector and faith-based organizations, is that we need to call on government to take up that leadership. That if we want to change the lives of children, 1 in 3 children are not going to reach their full potential until government steps in and pools, coordinates, unleashes those resources that actually Julian was talking about to invest in ECD. No one entity can do that until we actually get the coordination at the highest level. And I agree, every sector should be contributing to this. And the business sector has a role to play. The business sector should be there. I am a member of the food justice movement, and the food justice movement is looking at other avenues of generating funds. CSI is a plaster on a cancerous issue right now. We cannot just be saying, you know, we're doing a small CSI project when we know that children in South Africa, as a nation of children, we are failing them. And there are other countries that have proved that they can do this. Rwanda is doing much better than South Africa. In fact, Bangladesh is doing much better than South Africa. And yet we are an economic powerhouse in Africa. We do produce food, and we are not getting the food to where it's needed. And therefore, like the COVID command center, we need a food or hunger command center. And as civil society, we should be calling on government to step into that role. That's where I would see the conversation going.
I mean, you make a really important and interesting point, Dr. Whitten, and I wonder whether your colleagues are going to agree or disagree with you. Professor May, let me start with you. Do you agree, first of all, that it is possible to proceed without government and in particular the Deputy President's action on this council, which should have been activated 7 years ago, but hasn't been, and has thereby presumably made certain important resources inaccessible to your community?
So with Chantal some years ago, in fact last year, we produced the Child Gauge 2020, which focused on nutrition. And in that Child Gauge, we needed to think through what were the priority messages that we needed to send to government. And we agreed the formation of this council and why the council is important. At the moment, there is a technical committee that has been established by different government agencies under the Deputy President's guidelines, but it's only government officials. So it only provides some measure of coordination between different government departments. And even then, we get a sense that it's a rotating membership. There are different people who join the committee at different times, so you don't have a consistent and high-level process. The council is supposed to be a intersectoral council. In other words, it would involve potentially people like Omri sitting on a council who can represent the views of the commercial farming sector. It would involve people like Chantal, who would represent the view of organizations concerned with rights, and it would involve consumers. So it's more than just coordination within government, and it means that government is in the position to talk to and be held accountable by other stakeholders in society.
And Professor, makes complete sense. Sorry, continue. Were you going to add something to that?
Well, in the last year, I have started to question whether we are right, Chantal, whether the council has maybe become moribund. It's become redundant, and in fact, maybe we need to find other spaces in government where we can have a coordination function, because ultimately this is about a coordination function, and it's about a function which says we need to reprioritize, and we need to properly resource. If the council cannot be formed, then I'm starting to think we should be looking for other equivalents. Certainly now on the Planning Commission, there are a number of commissioners who are very concerned about child hunger. We have repeatedly called for placing children at the center of our planning. And that's our long-term planning. So yes, we can do the short-term measures, but if we are to think about the long-term, then we would want every part of the country, when we're thinking about the future, to ask the question, what does this mean for children? And what do children mean for that future? And that is whether it's Omri's colleagues in the agricultural farming sector, the faith-based community, again, thinking about your future parishioners, or myself as an academic, if I put that hat on, I need to be thinking about how do I plan that today's children are going to be my future students? How do we make sure that when they arrive, at a university, they are healthy, they have been stimulated through their pre-university education, and they are ready now to take the next step before entering the labor market. So that's why, as I say, I listened to you. I listened to you, Chantal, and I did start. I have been wondering for some time: is it the council, or do we need to find other spaces? If the council is not going to step up and play that role, then we must find somewhere else to go.
Mr. Van Zyl, may I ask you for your opinion on this? Because, I mean, you're one of the individuals that Professor May suggested should sit on any such council or any such body that does this important work, working with government. Do you see the council as the vehicle that needs to carry this burden in our country and alleviate it? Or should there be other mechanisms, perhaps, as Professor May is suggesting?
Oh, Joanne, South Africa is falling off a cliff. I mean, we all know that. We've got energy insecurity, we've got financial insecurity, we've got political uncertainty. We've got a lot of things that are really toxic mix in taking an economy forward. Economic growth for me is the imperative thing that we need to focus on. But having said that, councils are important, balanced councils are important, but more importantly in South Africa, and this is my view, we need very practical people. We need to implement stuff. We need to do stuff. We need to figure out stuff. We need to develop models that can be replicated over and over and over so that we can be successful. And I think Chantal and Julian, kind of mentioned it, but, in the end, who is responsible? So it's a mix of many organizations. So just thinking of who's in the conversation now, we've got religion-based organizations, we've got agriculture organizations, we've got academia, we've got people that can figure stuff out, but without actually implementing stuff or taking the things that are being implemented and going to someone. The issue with government is they don't have money. I mean, how are they going to fund these things? If they're not doing it already, why aren't they doing it? And how is it going to work 5 years from now? So my view is, commissions are important and balanced commissions are more important, but if a commission doesn't have a mandate to execute something, everybody sits in the car and agree with each other, but there's no diesel in the tank, so you can't go anywhere. So that's just my view.
Dr. Bahraine, would you weigh in on this, please? I mean, this is a reality in our country. Often government simply doesn't come to the party. If that happens in this case, if the command center is not activated, if other structures are not there to assist, if, as Mr. Van Zyl suggests, there's no money anyway, or there are no resources to assist with this battle, is it possible to go ahead as the NGO sector or civil society or academia, all the players, the corporate sector and so forth, is it possible for them to proceed, to forge ahead without the buy-in of government necessarily?
So, Joanne, a couple of points here. Firstly, it would be great, it would be helpful, like Chantal and Julian have suggested, that there is better national direction and coordination on these matters. And it is shocking that a structure that was identified in 2014 has not been put in place. So that's a dereliction of duty. It has resulted in competing messages, competing approaches. It's not that we're not spending money on addressing issues of food insecurity and nutrition. We're spending quite a lot of money, but there's no collective impact. We are wasting the money we are spending. There are national programs supporting community food gardens. There are provincial programs supporting community food gardens, and there are municipal programs supporting community food gardens. For example, there's no coordination between them. It means sometimes double funding, gaps in other communities. It's a mess. So I do believe that, whether it's this council or another body, one can debate that. And I agree with Omri, it can't just be a debating chamber, but I do think it is helpful if before you take action, you need at least a common agenda. You need to be on the same page, because otherwise you just, thrash around and implement a whole bunch of stuff without going in the same direction. Having said that, I think I would also focus as much on the bottom up as I would on the top down. And it's not either or, it's both and. I think you need both. You need government there with their resources, But it can't just be government. Government on their own is not going to solve this problem. And if government is going to fall behind, I don't have any problem with non-state agents, civil society, communities, working with business, working with donors, taking a lead. I think the days of waiting for government to get its act together are gone. And so if you look at kind of action from below, the starting point there would be to map out ways in which households and communities in poorer and vulnerable areas survive. Start with what communities are already doing, because they are surviving, barely and poorly, but they are taking steps to survive. So how do we support and enable that? Not come with new programs or parachute in with other solutions, but let's start with a household income, and where a woman-headed household, for example, has to make, in the middle of the month, an agonizing choice of whether to feed her kids or pay their school fees. That's what it boils down to. That's the kind of moral choice that people have, or the practical choice, which is, of course, no choice at all. And how do households get income to pay for that food and for the school fees and the other the essential ingredients of life? Well, it's a wage if you have a job. It's a stipend if you're in a public employment program. It's a small business if you can sell some, perhaps, chickens or food on the side. It's the system of grants. It's loans from the spaza shop if you've run out of money during the middle of the month, or from some loan sharks. And in the case of child maintenance, whether the father has paid the maintenance or not. These are the micro things that make the difference between surviving and thriving at a household level. Now, how do we support that economy? Because that is where the poverty is felt. That is where one can intervene to help people survive better and move towards the system of thriving. And I would say there's a whole lot of things that stop access to nutritious food, which actually have as much to do with municipal functions as anything else. They're not so much national or even provincial, but access to land, access to water, access to energy, access to storage for your food so you can buy in bulk. And how do you do that in a shack in an informal settlement? Access to cold storage so that you can keep perishables a little bit longer. These are the things, access to better transport systems for traders to go to the municipal market and get the produce there that is 30% less than the major supermarkets. All these things make a difference. And actually, that's why you need a whole of government approach, and not as well as a whole of society approach. It cannot just be left up to national government.
Thank you for that, Dr. Bahraine. Archbishop, I mean, we've heard both a mix in the last few minutes of the problems that exist with the system. And I think Dr. Bahraine has started to bring in some of the solutions that may actually work. I mean, as the Anglican Church, and working hand in hand with other mainline churches, you've got a huge reach that extends not just to particular municipalities or provinces, but across the entire country, and in fact, across the entire world. Can that be leveraged to do the kind of work that Dr. Bahraine is talking about? Or is it just not possible with the multitude of social responsibility projects that you as the ecumenical sector have to carry?
Thank you. I think I just want to go back to saying this. We have a moral obligation to make this work, all of us. And we are all instruments in God's hands, and we must use the resources and the skills that God has given us to care for most vulnerable in our society. And just to, lest I become less charitable, I mean, I'm involved in a project that Mr. Van Zyl was talking about with Patrice Motsepe, for example, working with business and the faith communities, really to impact, use our land and use the reach that we have as faith communities to do agriculture and generate revenue and deal with unemployment. And that is working. But I think I'm saying we need, broader than just Motsepe, Van Zyl, and the faith communities that are involved. So we need to look at how do we take that which is working and make it normative in South Africa. And Dr. Guchlenberg and some of us have been watching how the German churches work with their state. It's not an ad hoc thing of a few churches working with few connected people, but it is, agreements and bilaterals where we say churches and state, agriculture, academics, business, here is a task at hand. Can we have deliverables by when, how, who? We quite structured as churches. Now, if today we've got a minister who knows that they have to deliver in 5 years, after 5 years, they are gone, and the program changes, it can be very frustrating and disheartening. So you can leverage the heart of the church, the land of the church, the expertise within the churches. But the most important thing that I want to say is we need to work together. You know, the sin of working in silos, of saying government will succeed, or church will succeed, or academia will succeed, or business will succeed, is what is lacerating God's people. So we've got the convening power as the churches. We may not have the money, but we've got the reach as churches. And we are there not to serve ourselves. We exist in order to serve other people. And so the solution lies in bilaterals, by agreement, committing that we're going to serve the orphans, the vulnerable children, the unemployed youth, the young girls, the women, the persons with disabilities, the aged who live from around us. And we're going to work with our local partners, because there are many. We're going to take what Andrew was talking about and say, and Julian was talking about, what Chantel was talking about, what Mr. Van Zyl was talking about, and say, how do I take the people in the diocese of Mpumalanga, and my other diocese is Mozambique, to work in Mozambique? How do I work with the people here in Saldanha Bay, to work with the people in Namibia? And then we must maybe somehow have a broader picture than a South African one, a Pan-African one, because our churches work across these artificially created borders. Sorry, I don't want to preach because this is a very important aspect in my life, but the silos really frustrate me. Those that are closer to Mr. Van Zyl and Motsepe want to be around him. Those that are closer to Andrew want to be next to Andrew. Those that are closer to Julian want to be with Julian. Let's catch those boundaries and commit to working together. And I'm sure this is one area, if we are food secure, that we can actually do very well in serving particularly the poorest of the poor.
Archbishop, it comes through very clearly that you're saying collaboration and coordination ought to be the order of the day in this sector. So I'm going to get to the section now where I'd like each of my guests to just give me a sense of what immediate and most important interventions ought to be introduced in order to guarantee that coordination, collaboration, support, bringing the expertise in, and also, as Dr. Guchlenberg mentioned off air and perhaps alluded to on air as well, making this a campaign that is actively put on the national agenda for everyone to take notice of. Professor Whitten, may I start with you? What would the most important interventions be right now, in your opinion, to eradicate child hunger and malnutrition?
I'd like to call on the Arch to come with us to have a meeting with the committee that is currently working on the coordination, which falls under the council. So Julian alluded to this committee. I think with the support of the Planning Commission, of which we have representation and already a commitment to put children to the center of any plan in South Africa, I think for me, if you want to change, you have to work in relation to the resources that can be made available. It lies in the hands of government. Joanne, if government decided to have a 1% hunger levy on all businesses, no sector will ever be able to raise that kind of money. No UN organization will be able to bring that kind of money. So for me, and the kind of work I've done in other countries and seen how it's worked, I think we need it, and we owe it to the children to actually fight for them. We have a policy. We have a commitment to a council. We have civil society that is organized. And as the Arch said, we need to coordinate. And now that we have the faith-based organizations wanting the same thing, let us go and have that meeting with that committee, and let's leverage the resources that is owing to children of South Africa. I'm not for piecemeal activities. They work, but they don't change the future. They work for now. Andrew used a good example, a word. He said, survive. We don't want our children to survive. We want our children to thrive. And if we're going to get them to thrive, then we have to push for the biggest buck. And the biggest buck lies with government. So that's where I think we could work collaboratively, still pushing, do what you have to do on the ground, but push for the level of commitment that we need from our government. Thank you.
Dr. Bahraine, you've already given us so many ideas of how you would tweak the model, but let's penetrate a little bit deeper as to how local food systems could be supported in vulnerable communities. If, for example, you gave us the examples earlier of small businesses and small-scale farmers, the availability of fresh produce in local shops and that sort of thing in rural areas. And how would one go about putting those systems in place, Dr. Bahraine?
Joanne, let me give you a practical example. It's a modest example, but I think it's useful to reflect on what seems to work and what doesn't work. So in response to the COVID pandemic and the shutdown of the economy in 2020, we pulled together the Western Cape Food Forum. And initially it was coordination of short-term food relief from government as well as from private sector and civil society. And after about 6 months, we collectively decided that on its own is not going to change the food system. It's not sustainable. We need to do something more long-term and more systemic. And so we started trying to understand what this was. And we did it together. So what the Food Forum is, it represents about 180, 190 organizations. It's got a sort of about 450 people participating in it from time to time, meets every month. And we use the slogan, the 3 C's slogan: connect, communicate, and collaborate. We try and keep it as simple as possible. In face of crisis, people tend to withdraw and retreat into their own as a defensive mechanism. And so to improve resilience, we promote connecting. The relationship is everything. And we found that poor and vulnerable communities during COVID that thrived a little bit better were ones that were already connected internally amongst themselves and connected in some ways to their local authority. So there's actual direct value in building relationships and not waiting for the crisis. That's the first thing. So connect. Secondly, communicate. We need evidence. We need data. We need data not just from the scientists and the researchers, but also from the community themselves, because their lived experience produces the knowledge that we need to support the system. And we also need to deal with sometimes, unfortunately, fake narratives and fake news that goes around, particularly in a crisis where people are scared. So connect, communicate, and then collaborate. How do you get people to work together? And that means not just convening a forum or a dialogue, but starting to address the non-collaborative attitudes and behaviors that infest our system from top to bottom, within government, within business, within communities, amongst NGOs, and even well, perhaps sometimes, Julian and Chantal, especially in academic institutions, where there's a sort of sense of hoarding information and not sharing it. So how do we, in practice, get people to work together? So that's just an example of how we have tried to have to achieve collective impact So in this forum, there are people working on food gardens, the food growers movement. There's people who still do the food kitchens, the short-term stuff. There's groups of the ECDs. And Joanne, let me just tell you, if you want to know about how to sustain children through nutritious food on absolutely low budgets, speak to the cooks at the ECDs who work miracles every single day of just getting enough food and feeding those kids at 7 in the morning, a snack in lunch, mid-morning, a meal at lunchtime, and a snack to take home to feed their older brothers and sisters and things like that. Those are the people at the heart of a kind of food systems improvement. So relentlessly, we've got to ask ourselves, how do we support those existing networks that are already working miracles, but need a lot more support?
I mean, that is a fantastic collaboration because it's very sophisticated in many ways. And Mr. Van Zyl, I'm going to ask you a question about that in a moment. I just want to pick up on one aspect of what Dr. Bahraine said, being able to feed children at a fairly cost-effective rate, but ensuring those meals are nutritious. Dr. Wooden, I understand that you actually have a recipe book of some kind, or you have some sort of advice on building a dietary regime for children based on healthy food that's relatively inexpensive. Am I correct?
Yes, that's correct. I hope the PDF is available for the different platforms, but this is work that was done by the University of Stellenbosch, and it's based on South Africa's healthy eating guidelines. So the recipes that are in there are actually cost about 40 Rand per day to feed a family. And they are designed so that we can get to nutritious foods. The problem is, Joanne, if people don't have the economic access to buy those foods, it makes it very difficult. But I do want to say that we found a lot of good responses from our middle income households because they are also tightening their belts. They've also had to make changes. Not all families can eat meat every day. And so finding replacements and finding recipes that still give you taste and goodness is what's been packed into that booklet. And the booklet is available to share widely. So whoever has access to the booklet, you're more than welcome to share it electronically. And if you can print for others, please print for others.
Thanks very much, Dr. Witten. I'm not sure we should be eating meat every day anyway. Eat your vegetables, viewers. Professor May, before I bring in Mr. Van Zyl here, you said something really interesting earlier about government taking the approach of centering children in every aspect of its outlook. That would change the picture entirely across departments, social development, hundreds of other departments that I can think of that desperately need that approach in order to improve the lives of children. How important ought that to be in any kind of national program that we devise to alleviate malnutrition and hunger?
Well, I'm going to give you a short answer so I can talk to something that hasn't been spoken to yet. And the short answer is I think it's absolutely essential. And as you say, it would profoundly change how we think about doing things. If we are to do something as simple as raise the interest rates, which is we are doing right now, if the modelers in the Reserve Bank were to ask the question, and now what does this mean for children living in houses who are in homes that are going to have to pay more to service their debts? Then we can start to think about the trade-offs. Is that increase going to be, is it worth it? Is it actually going to achieve the goal that we're hoping it to do? What are the trade-offs that are involved? It may well be that an interest rate increases exactly what we need, but it means that at least we're asking the question, what does this mean for children? So that gets that out the way. A thing which has been left out, and you were talking about important interventions that we could possibly make. As we've been discussing, I was just thinking about the incredible convening power that exists in this group. Between us, we can convene millions of people, multiple departments, multiple stakeholders. Joanne, you yourself have managed to convene a remarkable group of people to talk about this issue, which for some may be a new topic. So we have the convening power. Andrew's shown us that once we've convened, we can know what to do as a group, even when we don't agree with one another, even when we have different perspectives. We've seen that there are ways of convening people and then doing something constructive. I believe that's a resource that we've already had. You asked earlier that an intervention that would make a profound difference, and I feel Chantal and I have changed roles today. She's talking about the long-term planning. I'm going to talk about breastfeeding. Because here we have something, an absolutely fundamental resource that would improve the health and well-being of the children in our country. The evidence is completely clear. Exclusive breastfeeding in the first in the first 6 months makes a fundamental difference to the well-being of that child. And yet South Africa's exclusive breastfeeding prevalence is incredibly low, much lower than other countries which are at the same level of income as us. It's a puzzle. It's something to do with mixed messages of the past. But it is quite clear that if exclusive breastfeeding is promoted, we're able to do something about making sure that at least for that 6-month period, we're giving a child adequate nutrition. And I think we need to be, one of the things we need to be doing, and here's a challenge to Chantal, since you challenged the Arch, to convene a group to talk to specifically about what are the challenges and the barriers and the issues that we need to be doing to advance exclusive breastfeeding in this country. I think getting that right is both a short-term intervention, but it's also something that it's long-term. A mother that is exclusively breastfed now is going to show her sister what to do. And then in turn, at some point, that child is also going to be disposed towards disposed towards exclusive breastfeeding. So that's the intervention that I wanted to put on the table.
Thank you very much for that, Professor May. Mr. Van Zyl, I mean, I'm listening to all the models that have been presented here, and possibly one of the most impressive is the one that Dr. Bahraine spoke about, the Western Cape Food Forum, because it takes such a vast approach to this and allows for many sectors to collaborate. And I'm pretty sure that's similar to a model that you've been working with the Patrice Motsepe Foundation and so forth. But I have a sense that there are lots of people who are involved in perhaps small-scale feeding schemes who are watching this broadcast and saying, I would love to be able to do this. I would love to be able to replicate this on a wider scale. Or I would love to be able to collaborate and coordinate my little enterprise with others who are in much the same situation so that we can grow this and we can make it a countrywide phenomenon. But many people just don't have the confidence or the skills or the ability to reach out the networks, to reach out and actually make those connections. How does somebody who is doing this in a little isolated corner of South Africa reach out and make those connections so there's greater collaboration?
Oh, it's a very good question, Joan. I mean, we get it all the time. And it literally comes down to, how do you build, as an agripreneur, as a micro-agripreneur, how do you build your business? Where do you get access to finance? And that's a difficult one because there's no real answer. There's no real... For example, if there was a developmental impact fund that we could use, it would make a massive impact to small scale farmers because all the banks and the financial institutions require security, right? So they need to bond something. And in all the projects that we do, that's one of the fundamental challenges is, getting access to that capital. I just wanted to mention something else, and I think it was Archbishop that mentioned it, is there are models that are working. And I think sometimes I'm talking from an agriculture perspective, where most of the poor people are kind of exposed to. We mustn't forget about the urbanization trend as well. I mean, if you go to these rural areas, there's generally people are much older. The young people go to the cities to work. But I think what the Archbishop said is that in terms of our own, there are models that work. And there are models that can be replicated. And that's kind of a bottom-up approach maybe. But if we can collaborate around those, and what's very important is the agriculture guys need to do with the agriculture stuff, and the other guys need to do with the other stuff, because sometimes you get people that come into the agriculture space that don't understand it, or they're not experts. And so each of us have our own areas of expertise. And if you can get those together from the bottom-up approach, I think that's great. Julian and Chantal mentioned the 1% sector levy concept. I mean, we've been working with the AgriCita. They've been doing fantastic. That's a much bigger kind of play, which I think is very interesting and important. And that could make a massive difference as well. But in terms of solving the problem in the short term, I would say, let's look at what works. Let's look at what can be multiplied. In the meantime, we can have high-level discussions about, how do we solve this problem broadly. And interestingly enough, the Archbishop mentioned Africa. We've also looked at these models in Africa and where they work and where they don't work. So there are solutions. I mean, there are solutions, and this is maybe a start of a conversation where we figure out what they are.
Thank you for that, Mr. Van Zyl. I'm going to take some of our audience questions now because we've got quite a few coming in. One of them is, could the panel comment on the potential of community agriculture rather than relying on the large commercial providers? Mr. Van Zyl, is that one you'd like to take, perhaps?
Yes, I'll take that one.
Thank you.
Must I take it now? Or?
Yes, please go ahead.
Oh, yeah, so there's many instances. I mean, we work with communities in agriculture. We have a Women in Agriculture initiative in KwaZulu-Natal, where we work with women specifically around community agriculture development in a variety of commodities. And it's been working really well. And the model, again, there is a model that you can replicate in all the other 9 provinces. So we are developing it as we go along. But there's definitely a massive opportunity for just growth and development in the rural areas around these agriculture community projects.
Thanks, Mr. Van Zyl. Archbishop, I think this is definitely one for you. One of our viewers says, perhaps we have all forgotten some ancient wisdom. When you reap the harvest of your land, you do not reap to the very edges of your field or gather the gleanings of your harvest. Leave them for the poor and for the foreigner residing among you. And that is, of course, quoted from Leviticus chapter 23, verse 22. Today, the harvest is all economy, which often leaves nothing for the care and food needs of the most vulnerable. The challenge is making need visible and matching to known but often hidden abundance. What's your take on that, Archbishop?
Yes, my take is that Levitical passage could also be used as a moral code, in fact, for people of faith, of no faith, different faiths, and struggling with faith, because what it says is really how much is enough. You can't just acquire for yourself. You need to remember, I don't need to remind business people that good business exists to give its revenue away. So there we are being reminded that sharing and is at the core. If we shared, we could eliminate a crime, we could eliminate a desperation. If we coordinate, we could draw in a lot of people than having a lot excluded. And it reminds me, I mean, this program has not yet come to fruition, but as the Anglican Church, we are engaging the Minister Togo Didiza to say, can we, as a start, have a memorandum of understanding with your department so that we can release some of the land that we have in rural areas for food and community gardening. We've done it in the Eastern Cape, in a place called Mahone, in a place called Bolotwa, where the land is still in the church, but the community farm it, and then the agriculture and business offer some practical tools. We're trying, Mr. Van Zyl, we're happy to know, to do it also in Mahoba's Kloof, where I come from. Besides being an archbishop, I'm very interested in avocados because I grew up with avocados not coming from chain stores. When I wanted an avocado, I would just shake a tree and the ripe avocado will fall to the ground. But Joanne, I want to go somewhere. I mean, this is a good webinar indeed, because you've all forced me to, and the Leviticus passage has forced me to think that I sit, for example, on Sukuma Trust, supported somewhere in Stellenbosch. I sit on the South Africa Future Trust, supported somewhere in Johannesburg. On this Motsepe, on Hope Africa, on the mining people on Marikana. And if these things were coordinated and replicated, I think the impact will be greater. And that's what Leviticus says. Don't hoard, Archbishop, and just sit on the board for the sake of sitting on the board. How many do you draw in order to share the expertise? And equally to the business people, to academia, to government, leave the space, leave some of your land so that the poorest of the poor can also learn how to till and create their own food security.
Thank you for that, Archbishop. I really think it's a brilliant idea, bringing all of those entities together, the ones that you sit on anyway. Here's a contention with one of the comments earlier, and I can't quite remember. I think it might have been you, Professor May, who spoke about a Ministry of Food. Please correct me if I'm wrong. But someone says, I don't believe that a Ministry of Food, like water and energy, will alone make the required difference. We need a struggle entity like the UDM for national food and nutrition security. This can drive government towards necessary work and investment. Professor May, could that work?
I think it was Andrew who talked about the idea that we don't have a Ministry of Food. Now, some countries do have such a thing. Germany, for example, has a ministry which links agriculture and food and agro-processing. So it's not an unusual idea to have such a thing. Do I think it will be enough? No, I doubt that. I actually think the food is only one part of the equation of people being properly nourished. And we will need to have ways in which we cross over to other departments. Sometimes I think we put too much emphasis on the production side, and that we see perhaps the Department of Agriculture as being the lead on issues of food security. That's not the case. Without proper sanitation, we can have as much food as we like. We will still have children experiencing diarrhea, and they will simply flush out the nutrients that they consume. So it goes well beyond food. I think it would be helpful if food was recognized more strongly, perhaps as being a department within a ministry. But that would only serve part of the function. Rather, we do need something like the Multi-Stakeholder Council or another coordinating body. And I think, like the Archbishop has said, recognize that there are multiple fora which convene and if issues of food, and in particular child hunger, were brought into play, we would then make more of a difference. I quite like the broad-based call for something which is about a food justice movement. They already exist. Chantal is part of one such organization, and I think those can play a very important role in both advocacy, but also raising awareness among communities of the issue of child hunger. Sometimes our communities themselves are less aware of the issues of child hunger than they ought to be. Again, last word before I end. Yesterday, while in Zwelathemba, I spoke to a woman who was selling and cooking tripe in anticipation of the demand for food following the SASSA payouts. And the question I asked to her, if you don't sell, if you don't get a good business day, what will you do with the food that's left over? And she said, I have many grandchildren, meaning she had many children that she knows in the community, and I will give the food away because it is better to give the food away to these children than see it go to waste. This is from someone who is standing on a street corner without any shelter, cooking beef offal, who is still aware enough to want to give the food away if she's unable to sell it. So I think that kind of mobilization is really important. Thank you.
Yes, so much to learn from that moment, Professor May. Dr. Kuchlenberg, you have your hand raised. Have we just lost you? Okay, I'm going to...
Thank you. I just want to echo what the Arch has said in the power of churches to convene and help people to work together In a previous role, he was excellent in raising international funds for the Global Fund in many of its international HIV and TB programs, even in South Africa, very successfully. I know this webinar is about making food security for children, to prioritize it for all of us. That is the main focus of today. But there is something in the room that we have to mention. South Africa is losing substantial resources that faith networks and churches could channel to South Africa if there were formal agreements with our government, if they are included in bilateral agreements with countries funding specific programs. Faith networks have an incredible formal and informal international network. We cannot capitalize on this if there's no coordination in South Africa. And I mean, really substantial funds were released. I was with the Arch when he campaigned the German government some years ago to raise their contribution to the Global Fund. And we've done that sometimes publicly, sometimes confidentially. Churches have networks that are incredibly powerful, but you have to have some kind of formal agreements and bilateral agreements, and our country's agreements with other countries needs to take notice of this, because many international agreements make provision for direct support to civil society, faith community kinds of projects. So it's not only on the academic or intergovernment level where it stops. That's the strength of the faith communities. I just want to mention this.
And that's important. Thank you so much for mentioning that, Dr. Kuchlenberg. There's a question, Omri, let me put a couple of these questions to you, because they're slightly more leaning towards the sort of economic front. One question is, surely basic food products should be VAT exempt. What's your take on that? Would that alleviate hunger in any significant way in the country?
It could possibly make a contribution. I haven't actually thought of that, to be honest. Generally, small producers are not vetted, but large producers and wholesalers are vetted. So it could make a difference to food prices for sure. Whether that's acceptable for SARS would be another question. So I just wanted to add one point, and I think we haven't discussed it, but something that I feel really passionate about is food waste. So it's difficult enough to get food and to grow it. But if you look at the amount of food waste every day that we lose in South Africa, that could nourish and, sustain many communities, thousands of people across the country. So maybe that's an idea for a venture capital fund or something, something innovative. But that is something that should be part of the food security discussion as well.
It's interesting that you mentioned that, Mr. Van Zyl, because that's one of the topics we've actually covered in the past with CAS, the Ecumenical Institute. And I see Dr. Kuchlenberg nodding there. But I think that part of the issue was the legislation around that. And I think it might be mentioning again, that the hands of people who are able to make that food that would otherwise be wasted available to hungry children, the hands are tied in the sense that there isn't the legislation that exists to be able to do that. Is anyone on the panel able to just address that quickly? Like the work of Food Forward, as Dr. Kuchlenberg has mentioned. Would anyone be able to refer to the laws preventing the distribution of larger amounts of food? To my understanding, I think about 10% of it is being made available now, if I'm not mistaken, but a much larger amount could be made available and solve the food crisis in the country. Dr. Bahraine?
Joanne, I mean, firstly, it's already being done by many NGOs. There's huge recycling of excess food to people in communities. So we just need to know how they're doing it and how do we increase and support their efforts. The second way one can use food waste is through turning it into compost. So much of the food waste goes to landfill, municipal landfill, and complete waste. And if you have local policies that make it a law to remove that food waste and channel it into the making of compost for small-scale urban commercial or subsistence production, you start building food resilience in communities. There are cities in other parts of the world that actually subsidize that and make it available for free as an important input into urban food production. Why can't we do that? There are municipalities that already have targets to take all food waste out of the traditional landfill and make it available elsewhere. So we just need to amplify those programs. But Joanne, the one overall point I'd like to make is that there are many good ideas out there, whether it should be more food items should be VAT exempt, or should we circularize the food waste economy and things like that. They're all good ideas, but they actually have to work together in a common integrated policy. You cannot have, good but small-scale piecemeal approaches to this. It's a complicated, complex system that does need an integrated policy approach, preferably national, but it certainly doesn't. It means that subnational government can start on policy approaches now. It doesn't have to wait for national. And I'd like to see more bottom-up initiatives from the policy point of view while we're seeing what we can do at the national level.
Thank you very, very much for that, Dr. Bahraine. And we're actually going to wrap it up there. I mean, can I, before I say goodbye to our viewers, can I please have you switch on your mics and just give me a yay in terms of the commitment to convening this body, working towards social justice as a coordinated and collaborative effort from the players who are on our webinar today. Would you do that?
Absolutely.
Absolutely.
Yes.
Okay, great. Thank you. Thank you for that, everyone. That is where we wrap it up for today, hopefully on a positive note. I really hope that for you, our viewers, this vital interaction will trigger a far wider and louder conversation and debate within society as to what can be done to alleviate the plight of children in this country. We need a touch of outrage. We need a significant dose of willingness and determination, but mostly a massive measure of action along with our compassion to prevent our children from being denied another meal. Tonight, millions of them all over our country will go hungry or simply not be able to enjoy a nutritious meal, which is so, so sad. But it will require that coordinated effort among all sectors of society to eradicate this ill. Thank you so much for watching today. If there is a way that you are happy to intervene, add your expertise, add your voice, I appeal to you to please do that. There are also 2 PDFs, which you as our viewers will be able to download to build on your knowledge about this issue. One of them Dr. Whitten has spoken about already, but there is another PDF that will also contribute to your knowledge in this area. Thank you so much for watching, and please make good use of the information that has been made available to you today by our experts. From me, Joanne Joseph, thank you for joining us for these Business Day Dialogues, live in association with the Konrad Adenauer Foundation and the Ecumenical Foundation of Southern Africa. Goodbye and take care.